Okay, hello everybody, and welcome to today's session for accessing IDPH data, our technical assistance session. This is our last one of the year and also our last one in general. So we're really excited to be able to have some really awesome folks joining us today. As a reminder, this session is being recorded, and if you do have an AI note taker, unfortunately, we do have to bump them. So feel free to come on yourself, but we can't have AI note takers in the room. So that's just a quick reminder. This series is made possible from IDPH and the Community Health Assessment and Planning Grant. For today, we're really excited, and that should be changed. My apologies. For today, we're really excited to have some awesome folks on the call from IDPH who are our data stewards for today. We'll hear about data suppression policy from Jane Fornoff. We'll hear about the Illinois Hospital Report Card and the Illinois Community Map from Antu Runyas, and we'll hear about the Healthy Illinois Survey Data Explorer Tool from Kelsey. And then we'll also, after each session, have a Q&A. So come prepared with your questions, and hopefully we'll have some additional time. If you're like me and you like to process things a little bit later, we'll hopefully have some time at the end. For our learning objectives today, participants, as I said, will be able to describe the data suppression policy and how to apply this knowledge when you're interpreting your data, utilize resources from the hospital report card and Illinois Community Map, and effectively use the Healthy Illinois Survey Data Explorer tool. Our group agreements today are to, as always, if you've been on these calls before, make sure you're actively participating. If you have questions and you would like to raise your hand or say it in the chat, either works. This is a very informal space, so feel free to unmute and ask your questions or put them in the chat and we'll make sure they'll get answered. And also allow the facilitator to move the conversation along if we have to move on to the next presentation. And we can parking lot anything that we cannot address today, and we can get back to you on those things. And so if there are no questions, we're really excited to be able to transition over to our first session, which is the aggregate data suppression policy with Jane Fornoff. So Jane, I'll pass it over to you.
Thank you. I'm just going to work out how to share again. Share screen. Share. Okay, so can you see my presentation?
Yes.
Fantastic. So I'm Jane Fornoff. Some of you know me. I'm based within epidemiologic studies. Thank you for inviting me. There we go. So IDPH has established a aggregate data suppression policy. This is aimed to protect, it's designed to protect personally identifiable health information and defines a minimum level of suppression. There's nothing to stop you being more suppressing further than this. But it also allows us to be consistent in how suppression is applied across IDPH with the local health department staffs and other IDPH partners, because it applies to all those users of IDPH data. I'm not going to show it to you today because it's a little dense, but there is a link here and the slides are going to be shared afterwards so that you can follow the link to take a look at it if you want to read it in more detail. Okay, so there are three approaches, two primary and one secondary approach to data suppression within this policy. The first is primary suppression, a straightforward, do not report data between 1 and 9 in any given cell. Alternatively, there is a risk assessment score. A score less than or equal to 12 means you can publish the data, and it evaluates the risk of identification based on characteristics of the data. And thirdly, this is the secondary approach, is if you can't make your data meet one of the two approaches, then you can ask for approval from the IDPH data governance team. So that is, it would be an extraordinary thing to get that, and would have to be for a very special purpose. Now, some IDPH data sets may have more restrictive rules, in which case you would need to follow those. But this is the standard approach. And I want to emphasize, you do not need to meet all of them. Any single one of them is sufficient to be acceptable for publication. So approach one is primary suppression. And as I said, data in the cell with a value between 1 and 9 cannot be reported directly. In addition to that, no data that allows calculation of a value between 1 and 9 should be reported. So in this entirely fictional table, we have a value of 9. We couldn't publish this table in this form. If we change it to a star, we've got rid of the 9, but it still can be calculated from the total and the nose by subtraction. So this is still not going to be an acceptable table. You would either have to suppress both categories and just report a total, or suppress the 9 category and the total and show the nose. Either of those would work, because you then couldn't calculate the missing cells. In addition to PHI, IDPH doesn't allow healthcare facility level data to be released that would reveal proprietary business data about the hospital or identify an individual supplying the data to IDPH. So depending on the data set you have, you also need to bear this in mind. And if data sets are combined, the suppression rules should follow the most stringent requirements. So if you have one that fits the standard suppression rule, this rule, but the other one has a more stringent one, you need to follow the more stringent approach. The second approach is the risk assessment score. This takes into account the rarity of the condition, or the numerator, the time period you're looking at, sex, age range, race, ethnicity, geography you're looking at, and interactions between these variables. So scores over 12 would require further suppression or approval from the IDPH data governance team. And I'm going to demonstrate this. I'm going to drag this over here, and hopefully now you can see the tool. I provided the link so you could come and play here to your heart's content. Can you see that? Is it big enough?
We can see it.
Okay, and it's legible.
Maybe like one more zoom in would help.
Okay, let me see what I can do here.
Top right corner, yeah. Right next to the star on the browser.
Okay, but I can't see the browser. Just a second.
Oh, sorry.
I have to go back to the Zoom meeting. I should be able to. Oh, here.
Yeah, there you go.
Sorry. How's that look?
Perfect.
Good. Okay, so I have an example here that I'm going to work through. Suppose you have an infectious disease condition where there are between 11 and 99 events in your region, geography that you're looking at. So you pick from the drop-down menu 11 to 99 events. We're going to look at a time reporting category of 1 year, so 2024, 2025. We're not going to look at sex for this particular condition. It's not one that discriminates by sex or gender. What is the smallest age range in the data? So we're going to look at 10-year intervals or greater than 10-year intervals. Here, I'm going to skip variable interactions because I always think about that last. We're not going to select race and ethnicity separately, so I'm marking each of those as not applicable. But I'm going to use a combined race, white, black, or Hispanic selection. And then I'm not going to use a service geography in this case. I'm going to use a residence geography, and I'm going to say it's a pretty small, with populations of less than 20,000. Now to come back to the variable interactions, we always are going to have geography, reporting period, and numerator, or events. But in this case, we've also got age range and race. So we've got two additional variables. So I'm choosing the events, time, and geography plus two variables. When I come down to the bottom here of the screen, you'll see that each of these characteristics is assigned a score. And 11 to 99 events is not very many. So it's got a higher risk of identifying somebody. So this score is higher. A 1 year reporting is pretty standard. So we've set that as our 0. There are some negative numbers you can have. The age range is 10 years. That's pretty wide, but geography is small. So that's a high score. So you can see how these are sort of calculated, and this is calculated to 15, which is not going to be one that we can publish because it's greater than 12. So I'm going to come back up to the top. I think that race and ethnicity is going to be more important than age for this particular condition. So I'm going to mark age as not applicable. That then changes my variable interactions. I don't have two variables. I've only got one now, in addition to events, time, and geography. And now I have a score of 12, and I can publish this data using these breakdowns. I want to do one more example, if you will all bear with me. I'm going to reset all my drop-downs. There we go. And now for this example, I'm going to choose less than 11 events. I'm going to choose, this is one where I actually want to report weekly, but monthly is the smallest I can choose. So I'm going to choose that one instead, and that's okay. Just choose the small, if you're going below, choose the smallest available. I'm going to choose sex, but I'm not going to have age categories. I'm not going to have race categories, so I'm selecting not applicable. I'm trying to select not applicable. And again, I'm going to choose a small residence geography. And I've missed one, the variable interactions. So we've got just one, which was the sex, in addition to our standard. So when I come down here, I'm at 19. That's pretty big. So I'm going to have to change what I'm doing. So I'm going to take sex out, and that'll recalculate, but it's only going to lose 1 point. When I change variable interactions, I still need to lose a lot of points. So I'm going to choose only events a minimum of 5. So rather than having a minimum of 9, where we're suppressing between 1 and 9, now I'm going to suppress between 1 and 5. And that gives me the 12 I need to be able to publish the data. So that's how it works. Remember, it doesn't need to be, it's independent of the other methods. So you don't have to do this and the others. And then I have just one more slide to help you think about ways to adjust the data to meet the policy. So you could limit your geographic detail. You could go up from your very small geography to bigger one, perhaps, but not if you're belong to a very small county. You could expand your time parameters. Instead of weekly, think about quarterly or annual, so on. You can group categorical variables into quite narrow. You could do black, white, other. Sorry, I've lost the. How did I do that? Okay, am I back?
All good.
You can top or bottom code numeric variables. So rather than having 5-year age groups for children, you could make them all less than 18. And you can group outcome data. So instead of different kinds of pediatric cancers, you group them all as pediatric cancers. And I think that is all I have. So do you have any questions for me?
Awesome. Thanks so much, Jane. This was a great presentation. Appreciate the demo. If anybody has any questions, feel free to unmute or drop them in the chat.
So, I'm sorry, I had a question about this. When we do our annual reports for the health department, um, do we need to use this tool to make sure, because it's a public information?
Yes.
Okay.
If you're using IDPH data.
Yes.
Yeah. So yes, if it's a public document, then it would have to be, you'd have to run through this process, either suppressing data between 1 and 9 in a cell, or using the risk assessment score.
Oh, okay.
Typically.
And what about our iPlans?
With whom do you share iPlan?
It is public knowledge because
Then
it's on our
yes.
website.
Yep. Anything that's published on your website using IDPH data needs to follow this guidance, this policy.
Thank you.
You're welcome.
Thanks, Bagya, for that question. Any other questions for Jane? We had one question come in earlier about asking why are small numbers a concern?
Small numbers, particularly when you combine them with identifiable information. So sex, age, race, things that are fairly obvious to somebody who's looking at you. Because then if somebody falls into an unusual combination of those categories, they can be identifiable. We did a study a few years back now with the cancer registry where we looked at Black people by zip code and over the age of 85. And we could identify people from just those 3 pieces of information. Oh, sorry, and county. Not everybody, but some. And we want to try and avoid that wherever possible. And the smaller the number, the more likely somebody is to fall into a unique category.
Thanks so much, Jane.
You're
Any other questions for Jane? We'll have some more time at the end. Just for time's sake, though, we'll move on to our next presentation. I'm glad to be introducing our next presenter today, Antu Runez, who will be presenting from the IDPH division on patient safety and quality on the Illinois Hospital Report Card and the Illinois Public Health Community Card. I'll pass it over to you.
Thank you. I'm going to try to do the same and share. Yes. Let's see if I can do this. Okay,
Perfect.
Let me move this side. Okay.
Looks good.
Hi. Okay, great. Hi, good afternoon, everyone. So let me do this. My name is Antu Ronas, and I'm the Senior Epidemiologist for the Division of Patient Safety and Quality. I'm also the data steward for the hospital discharge data. So if you ever have questions about that, I'm the one that you would be asking it for too. So today, there are two sites. It's actually one website. It's a hospital report card website, but it has two different um, I don't know, independent or complementary pages that is, to me, kind of be taken together. And I'm going to help you kind of navigate through that, especially because of this audience. I'm going to try to get some shortcuts so that you guys can get some of the information that you might find helpful for your work. So one of the caveats for this is that we just basically relaunched the hospital report card about last year or so. So we're really still expanding and refining a lot of throughout the site. So we do welcome questions, feedback, and comments. We definitely from our users, because then it will just have us improve more. Okay, so the two sites, I should say, is one is the community map, is what we call it, the Illinois Public Community Map, and that is a community-based data. It is regional, and it actually has about 431 measures, individual measures, and we'll go through that a little bit. And the hospital report card, the main difference is that is a facility level reporting. So all of the facility level information is in that site. And we have about 267 measures for that. Both of these are updated annually. The community map is in the fall, winter. We are due for one next month. So the data that you're going to see is older, but it is going to get updated next month. The hospital report card is updated in the earlier half of the year. So that the next one would be next year. So I'm gonna just jump into that one. Okay, so the community map. I'm gonna kind of go through fast because there's a lot here to navigate, and it might look a little confusing. So the categories are in these drop down boxes. So you just pick one, and then the measures are by all races and stratified by race ethnicity. So you can directly go to the population of white residents or Black or what have you. So the way that it's set up is regional. So here you have, it's broken down by these bigger regions, and then it goes down smaller. So if you click on that specific region, it'll bring you to the county in your county level. And as you hover, you'll see the rates associated with that measure. Okay. And then the zoom button will just pop out and in. There is one thing, Cook County. Cook County is the only one where zip level rates are going to, data is going to be available. And because of this, the data reflected here are 3-year average values of crude rate. We do not do we did not do the age adjusted because it was throwing off a lot of the very stratified values. So this is crude rate, 3-year average, okay? And zip level is only for Cook County. So if you have it, you can get these information. Now, as you notice on the side, on the right side, the demographics here kind of like goes along with that. This information here, the data here is from the census. And you can export it, but it's gonna look really funky because it's API. So there's a lot of information here. If you need this information, call me right now, or I mean, contact me at this point, or go ahead and export. The data itself is downloadable. If you click on here, you are going to have a download. It's a CSV file. And the download is going to have all of the data that we have. It's going to have all of the regional as well as all of the historical data that we have on it. So, I mean, it's for us right now, it's like one shop. You just get everything. It is only the rates that you're seeing. If you need denominator or the numerator, contact us, okay? But it's just going to be the value that's reflected on the site. Okay, so save that. So that is basically the crux of it. So you just look through this, the category, choose your measure, see what you want to look at. For Cook County, you also have the metro regions. Okay, so if that's helpful to you, and then you could just zoom out. That's all I'm going to say about this. This was supposed to be slated to be revamped and pretty much remodeled next year. However, that's paused now because of that's on pause indefinitely until we figure out where this is actually going to be moving, and it might potentially move. But if you have any questions on this, let me know. So now we'll jump over to the other site, which is the hospital report card. And this is by facility. It is facility level data. So this is our landing page, and you can get our search capacity is pretty extensive. You could search on any page. However, for local health departments, I love this. I'm just gonna just jump right into the county. When you jump into the county, this page is going to list all of the facilities and the ambulatory surgical centers for your county. So this is, I think I love this one. So if you click on, let's say we'll go to Condal. In Condal, all of the facilities will have a profile page such as this. And you could download any aspect of it. Just look at the icon. If you want this specifically for the insurance mix, you download that. However, if you want to download everything, just do export all. And it will again give you the, well, let's do it. It'll give you, it's a little bit bigger. So, and it will give you this crazy. It's just so much data in here. So, and they'll have the numerator, denominator, and the value, and all of the measures and things like that for the facility only. Okay. So it's for the individual facility. So that's one of the key things. So for that facility, you could also look at other things, patients' experience, services, emergency room utilization, patient safety. Let's look at that one. Let's look at that one. So this would be your CDI measure. This is coming from the NHSN data, CDC NHSN data. So there's that. Okay, there's just a lot of information in here. The data source is coming from about like 11 different data sources. And it's just massive. So one of the other things I want to go through with you is some of the measures. If you're interested in the measure search, you go to this facility comparison or measure search. There's a couple of things here. So let's say we want that CDI again. Okay, so we go down to the measure, and then let's say I want it statewide. So I click on this statewide, and it's going to take a little bit because there is a lot of data. Okay, so here you could see the list of all of the for CDI and here's the year 2024. You can see all of the measures, all of the CDI values for all of the facility statewide. Again, you could download that. You could make it into your, what have you here. So if you see, and anytime you see this little arrow, you could also click on that, and then you'll see all the historical data for that measure as well. Okay. But if you download, all of the historical data will be available. Okay. So that's one of the things. Another thing is this side-by-side comparison. It's going to give you, we only have up to 3, or else it just gets too loaded. Here we'll have this, and it just randomly pops it up. But if it's not the one you want, you just get rid of that, and then you choose what facility you need. And then it's just you just keep on scrolling down. You want patients mix. Here it is. Unfortunately, right now we do not have a download for this just because of the immense data that goes into this. However, if you individually click on that on the hospital that you want, you can go ahead and export everything. Okay, what else? Another one of the other things that is newer on this site, and that let's say you want all the data, every data, you just want to download it. And we don't have that capability because I say it is huge. This is a massive. But if you are familiar with API, you are able to do that too, or work with your IT to be able to bring in all the measures, the hospital information, ASCC information, and here's all of the things that you could look at, list all the measures. I mean, it's really intuitive. If you're familiar with the API system, here's the URL for that. And then here's all of the attributes that you could use in your search. One of the biggest thing here, if you want 2 things, is the measure ID is the key, and the entity ID. Entity ID will be the hospital, and the measure ID, every measure will have its own ID. So if you're familiar with using this, or your IT people can help you download the data. This is a faster way of downloading all the data if you want to, if you have the storage place. But this is a new feature that we just like rolled out, like, I don't know, the last a few months ago. So I think I'm not sure how much time I have up to, but there's just so much more to this. You can find by facilities individually too. You just type things in OSF, and it will populate. It's pretty smart. And if it's not, let me know. And then we will try to try to fix that. But yeah, you could do by this. This search would be like all of the OSF facility. So the search is really, really smart. And just try it out. I think the best way to know how to navigate through this site is just jump in and play with it. But yeah, but your searches are going to be your search profiles and things like that. They're everywhere, and they will help you. They'll get you to where you're at, where you want to find. If you want facility, search facility. If you want measures, search for measures in the page that I sent you. I mean, that I showed you. And I think I'm is my timing up? I think
Yep.
that's about it for me.
Awesome.
That was like a speed. Speed.
A lot of great information though, so thank you so much for that. Anybody have any questions for Ann too? I see there was one question that came in earlier, um, and this may have already been answered, but the question is, does the Illinois community map or do either of these specifically help to identify health inequities based on social determinants like housing or education and based on race?
Okay. So on the community map, you'll have your demographics that kind of runs on parallel with whatever measure you're looking at to the right. Um, so that's one of the we have and that is from the census data. That one will have the social economic education, those kind of parameters. And then for the community map itself, the measures, excuse me, they are stratified by race, ethnicity, by region, so and by again by measure. So I hope that answers. The information is there. Hmm.
Great. Thank you so much. Any other questions for Intu?
And just a caveat to that, this one is community map, as I said, is going to show your the county level, region, and things like that. Um, it's you could it's a you could see the neighboring regions to see what's your actual burden and what have you as well. And then these two sites can be taken in together and in tandem, so that when you want to see locally, oh my goodness, I forgot to show you. There is, for those that are working on community assessment, on the profile sheet, on the profile page, there is a link to all of the facilities community assessment from their facility. So that is, I think that would really help you identify a lot of the community assessments that was performed from the hospital, individual hospital. It is available to almost all of the facilities. So there is a link in the hospital profile page that I had shown you.
Awesome. Thank you, Intu. Would you be able to drop that link in the chat so people can find it? Oh, thanks. Oh, awesome. Oh, I think you're on mute if you're talking.
Sorry about that. I muted myself. Yeah. So every facility will have a link to their individual pages. Yeah. So like, yeah, all of them. Let's see. Good Shepherd will have it on their profile page. See, they'll have their website as well as the community health needs assessment. Okay. I hope that's helpful. We really did this for a lot of the local health departments.
That is so awesome. Great. And I'm seeing a lot of thumbs up and claps and hearts. So that is awesome. Thank you so much, Antu. And if anybody has any more questions, we'll likely have some time at the end that you can answer, that you can ask those questions. And lastly, but not least, we're very excited to have Kelsey Cutler sharing the Healthy Illinois survey and talking about it and the Data Explorer tool. Kelsey?
So I'm going to start with just doing a quick overview of the Healthy Illinois survey. I know this, the Healthy Illinois survey was presented at a previous session, but I wanted to highlight a couple of key things that would be relevant to the Data Explorer tool. So the Healthy Illinois survey was legislated, and this kind of highlights some of the key points from the legislation, where we are to provide data for all of the counties, for zip code groupings, for the suburban Cook County municipalities and the Chicago community areas. We are also supposed to provide data at various demographic levels. And then this highlights the areas where the topic areas that were supposed to be included in the survey. And then here are the topics that were included in the 2024 and the 2025 Healthy Illinois survey. And you'll see they cover a wide variety of areas. They cover some of the general health topics that you'll see on other health surveys. They cover more specific areas like our social determinants of health, our neighborhood questions, our adverse childhood experiences. All of these are kind of typical from other surveys you may see with the California Health Interview Survey, the Healthy Chicago Survey, the Cook County Health Survey. All of those were taken into consideration as we were building our questionnaires here, so that we had some standard, well-practiced questions. Our timeline for the Healthy Illinois survey is that we do data collection throughout the entire year. We're in the middle of 2025 right now. We're preparing for our 26 and 27 questionnaire. We get the data back around sometime in the beginning of the summer, and we're hoping to be able to produce reports and publish data by the end of the summer. I want to note that for some of our small geographies, we recognize that those areas may not pass our suppression rules for a single year of data. So we are planning on creating multi-year data sets that will allow those counties to also have data year over year as we do like a moving average. And then here is our Data Explorer tool. And here is the link. Let me see, I was going to put this in the chat. So if anybody wants to follow along there. And then real quick before I move over to that, here's my email. And then we also have a general Healthy Illinois email for any questions you may have after this. Okay. So this is our home screen for the Healthy Illinois Survey Data Explorer. It kind of highlights the three main areas of the tool. So we have our reports section, which is going to give you some static data where we have already generated the data for these reports using what we have identified as key estimator variables that you'll be able to generate topic reports for any specific topic area from the key estimators, or a community report that will give you all of the data for a specific geography that you select. Our analyses section will allow you to do custom analysis with either crosstabs or regression. And this has available all of the variables from Healthy Illinois, so not just the key estimators. And then our interactive maps, which uses the key estimator data from the reports, and also will generate maps for all of the counties or all of the Cook geographies or all of the zip codes. So I will start with the reports. And we have, like I said, two different report types. I'll start with the topic report, which this would be useful for if you were working with a specific program and wanted to get the data for all geography levels for this specific topic. And right now we have our 2024 data here. Like I said, eventually we'll have multiple years here. We'll have our multi-year data set here. Once we get like we get 2025 back, we'll have 24, 25, and we'll have a combined 24, 25 data set. So first, then you'll select your topic. For this example, I'll look at current asthma status. Then you can select your geography. And you can select either one location or you can select multiple. And we have our county level data. You can look at Cook geographies, which are our municipalities and the community areas, or you can look at zip code. So for this, I will look at counties, and you can either, like I said, select one or you can select multiple. So for this, I'm going to select all counties. And then under options, you can either break the data out by sex, you can break it out by race, ethnicity. You also have the option to compare to Illinois. So I'll go ahead and compare to Illinois and then generate the report. And it produces a map that as you hover over, you can see the data for any of the geographies here. And it also produces a table. And if you had fewer geographies selected, I think the limit is like 10. It'll also display a bar chart for you. One thing I want to highlight is you'll notice here some of the numbers have little carets next to them. These carets indicate that the data is a small area estimate. So like I said, we expect some of our smaller geographies to not be able to pass the suppression rules with individual year data. To allow for those counties to still be able to produce data year over year and be comparable to the other geographies for a specific year, we produced some modeled estimates, some small area estimates that will allow them to have data every year in those single years. Now, this data is different from our direct estimates. This data is good for comparing in a single, they are point in time data. So it allows you to compare to these other geographies, but they are not ideal for doing any sort of trend analysis. That is where you would want to use the direct estimates that you're going to get from those multi-year data sets for those small areas. And you'll see at the top here, you can export these reports to PDF or Excel, or you can also use an email to make an account and save them to your library so that you can save any of the queries you do on the site. Now, for a community report, this is going to be good for, say you were a local health department looking for data for your iPlan. Here you can pick your specific geography, and then you can select any of the topics for that are available here. So for this example, I will pick a county. And we also have where if you wanted to do like a community report for like some of our overall geographies for Illinois or the community areas and municipalities, you could do that too. Again, our year is just 2024. And then for topic, you can pick an individual topic and get the data, all of the data available for that topic area, or you can come and pick all topics and it will give you the data for all of the topics available for that geography that you selected. And again, it all can be exported or saved to your library so that you know where it is if you were to come back here. So that is the reports area. The analysis area, like I said earlier, is for you to do your own custom analysis. So if something wasn't available in the report section, but you've seen that, you know, we asked a certain question on the questionnaire, you didn't see it in reports, you can come to the analysis section and get that data here. So like I said, you can do crosstabs or regression. For this, I'll walk through a crosstab example. We also, on the Healthy Illinois survey, at the end of the survey, they were asked if they wanted to continue and take a supplemental survey. And for 24 and 25, we had the adult tobacco survey that they could take. So this data is also available in the analysis section. So for your topic, like I said, you can do crosstabs here. You could also just do a regular frequency analysis if you did not want to do a crosstab and just wanted to look at the one variable. And to do that, you would just turn this off. So first, if I click on my topic here, then it produces all of the variables that are available for that topic. And you'll see we have some questions here, and we also have some calculated variables or collapsed groupings that we produced to kind of make it easier to analyze the data with what we have seen as a good way to report out. So say, for example, I'm going to look at our general health variable. And for this example, we also have the ability that you can combine or exclude responses. So say, you know, even though we have this grouping here, say for your need, you needed to group these differently. You can turn this on and you can drag and drop and create your own custom grouping. And I want to note here that when we do this, it'll also exclude our don't know and refusals, since those are not valid response options. We generally recommend excluding those. So I'll save that, and then I will switch to my column variable. And for this one, let's do health insurance status. And again, you could do, this is just a yes, no, but I can exclude those don't know and refusals. And then we'll pick our geographic area. And here you can either do your single location or you could combine locations. So this would give you like a custom region that you would get data for. This could be useful for like if you were a hospital and you wanted to look at data and maybe combine a group of zip codes together to produce data for your service area, something like that. That's where you could get that kind of data. You can also compare two locations if you wanted to. And similarly to the other reports area, you have Illinois, county, community areas, municipality, and zip code level. For this, we'll just look at Illinois. And this is our crosstab table that it produces. So you can see we've got our custom groups, and we get a table percent, row percent, and column percent. So this way, you don't have to go back and forth and switch what your row or column variable is. You could look at, of those who say yes, what percent, says excellent or good, fair or poor. Or if you wanted to look at the other way and say, of those who say excellent or very good, how many, like what percentage said yes and what percentage said no. And then just down here, it gives a note of what was excluded. It would also give a note if any of these values were suppressed, they will be replaced with asterisks. Now this side of it does not use small area estimation. So you will not see any of the data replaced there with small area estimates. If you were to have some of those small geographies, they will just be suppressed. And then, yeah, the other option is to do a regression. For time's sake, we're not going to go through that example for now. But our other way we have to view the data here is to do an interactive map. And this is very similar to the map that we saw in the reports section. The report section, you can kind of, if you were to not select all, it would display on the map the specific geographies that you selected there. Here, it'll display the data for all of the geographies available for the level you select. So if again, we'll just look at asthma. And it's giving us by county. We can look at it by community area and cook combined to get a whole overview of all of the sub-cook geographies. And then we can also look at this by zip code level. So you'll notice here this got grayed out. Our options are to look at this by sex or by race ethnicity. Neither of these are available for zip code, and that's the same in the reports. You can only do this breakout for the county or the cook geographies. And then you can also select to compare to Illinois, and it has the same feature where you hover over and it'll give you the data. So that is how you can get the data. We have an about section that gives you just an overview of the survey, talks a little bit about the data, gives some more information on the small area estimates. And then we also have our documentation available here where you can get the methodology reports, the questionnaires, code books, anything like that will be here. We are in the process of developing a public use file and documentation that will go with that. So that will be here as well. And then under help, we have some how-to videos that will walk through, again, how to use each of these sections. We have a few frequently asked questions, and then if you wanted to contact us, you could fill this out. And then you would click here to access your account that you would make with your email to access any of your saved queries. And that is it for this. So let me know if you have any questions. Again, here is my email and the email for just kind of our general Healthy Illinois email.
Thanks, Kelsey. We have about 6 minutes left and 2 questions for you. So question 1 is, can I request county level data for my county?
Yes, you can. So your county level data, you can come here and get that. If you have, I know there's a data use agreement out there that they're trying to get with the counties. If your local health department has that data use agreement signed, we would be able to provide you with the data for that county. But otherwise, we would be giving you the same kind of aggregated tables you would find here. But again, if there is something that's not on here that you do see in the questionnaire that you would like, then yeah, you can reach out to us and we can provide that for you.
Awesome. Thanks so much. And a good reminder, I think most most local health departments have signed the data use agreement. But if they haven't yet, check with your local health department administrator. And the second question that we had for Cook County, are you able to break out suburban Cook from Chicago?
Yes. So that is how our, if I go through here, it doesn't, we'll look at, all of our stuff here, other than the interactive map displays them together, but everywhere else we'll have them separate. Our Cook County municipalities are available here. You can select all of those if you wanted an overall for sub Cook, or you could do the community areas to access the Chicago data, and do an overall to get just Chicago. And that's the same thing on the analysis. There is in the geographic area where you can select to look at the community areas, or you can look at the municipalities separately.
Awesome. Thanks so much, Kelsey. Any other questions for Kelsey, Jane, or Anne too? I want to highlight that there was one additional question asked for Jane at the top of the meeting. So folks, if they didn't see the chat, they can hear it now. The question was, is the data suppression rules already being used? And Jane said, yes, the policy has been published, although not well communicated. So thanks for that, Jane. Awesome. Great. If there are no other questions, we can do a quick closeout in our last 3 minutes here. So we want to thank everybody who was able to join today. Thank you if you were participating, or thank you to our presenters, Kelsey, Antu, and Jane. I just launched our Zoom poll to ensure that everything we do has quality improvement and we can improve upon every single instance that we meet together. If everybody could take in the last 3 minutes some time to respond to the evaluation, that would help us out so much. And if you have any additional questions or want to follow up, feel free to send us an email, or you have their contact information, and we'll send the follow-up slides with all of their information as well. So thank you again to our presenters. Thank you all for participating. And before you hop off, if you could do us a quick solid and respond to this poll, that would be so, so, so helpful. So thank you all so much. And once you respond to the poll, feel free to hop off.
Do we get a recording of this one, Samantha?
Yes, we'll
What?
be IDPH is in the process of uploading all the recordings from this year. And once they're uploaded, we'll make sure to send them out to everyone who's been participating.
Wonderful. Thank you so much.
Thank you, Bagya.